Good morning. Today's class is on aminoglycoside antibiotics. By the end of this session, you will be able to describe an aminoglycoside and why it is called an aminoglycoside antibiotic. What is the mechanism of action of aminoglycoside antibiotics? Describe the pharmacokinetics of aminoglycoside antibiotics, their spectrum of activity, uses, and adverse effects. Aminoglycoside antibiotics are chemically amino sugars with a glycosidic linkage, therefore the name aminoglycoside. They are effective against gram-negative aerobes like E. coli, Proteus, Klebsiella, Enterobacter, and Serratia. Now, depending on the organism from which the aminoglycoside is obtained, there is a small change in the spelling. Those aminoglycoside antibiotics which are obtained from Micromonospora species are spelled with an I, like gentamicin, amikacin, nettlemycin, and cysomycin. Those obtained from Streptomyces species are spelled with a Y in their spelling. Examples: streptomycin, kanamycin, neomycin, tobramycin, etc. Now, the aminoglycosides can be administered only by the systemic route for most uses. These are some of the aminoglycosides which are used. Gentamicin in the dose of 3 to 5 mg per kg per day, intramuscular or intravenous. Arbacacin, semisynthetic. Nettlemycin 3 to 5 mg per kg per day. Tobramycin, same dosage. Cysomycin also 3 to 5 mg per kg per day. Amikacin, streptomycin, kanamycin. Now, these are the aminoglycosides which are administered systemically. Neomycin, pramycin, and gentamicin are also available for topical use in the form of ointments, powders, and drops. The mechanism of action of the aminoglycoside antibiotics is they bind to the 30S bacterial ribosomal subunit and cause misreading of the messenger RNA, which results in the synthesis of defective proteins by the bacteria, which are lethal or cidal to the bacteria. So, aminoglycoside antibiotics are bactericidal. To repeat, the mechanism of action: they bind to the 30S ribosomal subunit of the bacteria, cause misreading of messenger RNA, synthesis of defective proteins, which is cidal. We mentioned under the extended spectrum penicillins, that is those penicillins which are effective against E. coli, Klebsiella, and Proteus. Aminoglycosides are synergistic with the extended spectrum penicillins. The reason is the penicillins inhibit cell wall synthesis, therefore the penetration of the aminoglycoside is better into the bacteria. Now, this is again a little more in detail about the mechanisms. So, at the 30S ribosomal subunit, the aminoglycosides interfere with initiation complex of peptide formation. Therefore, there is misreading of the messenger RNA, which results in the wrong amino acid being put into the growing peptide chain. And also, the aminoglycosides block the release of the synthesized polypeptide. So, this combined effect of defective protein synthesis and blocking the release of the polypeptide accounts for the bactericidal activity of the aminoglycoside. A frequently asked 5-mark question in the university exam and internal assessment is: describe the general properties of aminoglycosides. Means these properties are applicable to almost all the aminoglycoside antibiotics. So, chemically, aminoglycoside antibiotics are amino sugars with a glycosidic linkage. They are highly polar, water-soluble cations. That means positively charged. Therefore, they are water-soluble and used as their sulfate salts. Now, being highly polar, because of their positive charges, absorption on oral administration is very poor. Therefore, they need to be given intramuscular or intravenous. Being water soluble, they are confined to the vascular compartment, meaning crossing of biological barriers like the blood-brain barrier or the placental barrier is very low. Being highly water soluble, the aminoglycosides are excreted mostly unchanged by glomerular filtration. Therefore, the elimination of aminoglycosides is dependent on renal function. They are active mainly against gram-negative aerobes. Why gram-negative aerobes is because the uptake of the aminoglycoside by the bacteria is an oxygen-dependent process. The mechanism of action of all aminoglycoside antibiotics is they inhibit or they block or they bind to the 30S ribosomal subunit, cause misreading, and they also block the release of the synthesized polypeptide and are bactericidal. Aminoglycoside antibiotics are synergistic with extended spectrum beta-lactam antibiotics. Common adverse effects to all the aminoglycosides are they are ototoxic, nephrotoxic, and they cause neuromuscular block. Ototoxicity can be in the form of cochleotoxicity, that is by damaging the cochlear branch of the 8th cranial nerve responsible for hearing, or vestibulotoxic by damaging the vestibular branch of the 8th cranial nerve which is responsible for balance. The symptoms of vestibulotoxicity typically include vertigo, imbalance, and visual symptoms. Nephrotoxicity is a very important adverse effect of the aminoglycoside antibiotics. The most nephrotoxic being neomycin, gentamicin, and tobramycin. Nephrotoxicity of aminoglycosides is a result of excessive accumulation of the aminoglycosides in the proximal tubular cells of the kidney. If detected early and the aminoglycoside is stopped, it becomes reversible. The mechanism of action of neuromuscular block is aminoglycosides reduce the release of acetylcholine from motor nerve endings. Therefore, aminoglycoside antibiotics are relatively contraindicated in myasthenia gravis. Intrapleural and intraperitoneal neomycin and streptomycin are more likely to cause neuromuscular block. And the use of competitive neuromuscular blockers increases this risk. Coming to the uses of the aminoglycoside antibiotics. Streptomycin is used in tuberculosis, subacute bacterial endocarditis, and brucellosis. Neomycin is too toxic for systemic use. Is used orally for gut sterilization before bowel surgery and in hepatic coma. Why in hepatic coma? In hepatic coma, what happens? Urea cycle, that is the combination of urea, ammonia and carbon dioxide to form urea, which is taking place in the liver. Because of hepatic damage does not happen properly, there is a resulting accumulation of ammonia, which is a powerful CNS depressant. When neomycin is administered by the oral route, it kills the microorganisms in the GIT which are responsible for producing ammonia. This process is called gut sterilization. Neomycin, sisomycin, pramycin and gentamicin are also available as ointments and powders. Gentamicin eye drops, gentamicin eye ointment, neomycin skin ointment, neomycin dusting powder for topical use. The others like tobramycin, amikacin, nettlemycin, these are used for gram-negative aerobic infections like septicemia, urinary tract infection, osteomyelitis, and in pre- and post-operative prophylaxis. The pharmacokinetics of the aminoglycoside antibiotics. Being highly polar, water-soluble compounds, they are not absorbed adequately on oral administration. Only about 3% is absorbed on oral administration. Therefore, they have to be given by the parenteral route, intramuscular or intravenous. Oral administration is used, like we mentioned earlier, for gut decontamination or gut sterilization, for example, in hepatic encephalopathy or hepatic coma, given by intramuscular or intravenous routes. Intramuscular administration, the absorption is good. A point to note here is, because beta-lactam antibiotics inactivate the aminoglycoside in vitro, that is outside the body, they should not be given in the same solution or same syringe. Topical neomycin is used for preparation or decontamination of wounds. Being highly polar compounds, they are distributed in extracellular fluids, that is, they are confined to the vascular compartment with limited tissue penetration, like they cannot cross the blood-brain barrier, therefore CNS penetration is poor. Does not penetrate into milk, or it may cross the placenta. Exceptions are, like we said, ototoxicity and nephrotoxicity. Relatively high concentrations get concentrated in the renal cortex of the kidney and endolymph of the inner ear. Being highly water soluble, they are excreted unchanged in urine by glomerular filtration. Almost 99% is excreted unchanged. Now, because it is excreted unchanged by glomerular filtration, impaired renal function reduces both the rate of excretion and its accumulation in the inner ear tissue, causing nephrotoxicity, ototoxicity, or both. The clinical uses of aminoglycosides, they are excellent for infections caused by gram-negative aerobes. Gentamicin is the most commonly used. Amikacin is particularly effective against resistant organisms. Tobramycin also has activity against Pseudomonas aeruginosa. Short-term empirical therapy for serious infections pending the outcome of diagnosis. That is, for emergency empirical treatment, aminoglycoside antibiotics can be used. Some of the serious infections which are indications for aminoglycosides include septicemia, endocarditis, intra-abdominal infections, peritonitis, urinary tract infections, respiratory tract infections caused by susceptible organisms. Streptomycin is almost exclusively used in treatment of tuberculosis. It's one of the first-line drugs, and topically for eye infections, infected burns, and wounds. Some important drug interactions with the aminoglycosides. Ototoxicity is increased by loop diuretics like furosemide, which by itself is ototoxic. Pharmaceutical interaction with beta-lactams, that is, a penicillin and an aminoglycoside, if they are combined using the same syringe or in the same solution, the aminoglycoside gets inactivated. Therefore, we need to use separate syringes. So with that, we come to the end of the aminoglycoside antibiotics. So what are the things one needs to know? General properties of aminoglycosides, spectrum of activity, clinical uses, adverse effects, and drug interactions. Thank you.